Good day, everyone. I'm Ethan, moderator for this webinar. I'll welcome everyone for today's webinar, HHS Mandatory Email and Text Message Encryption, Rules with Only One Exception for Informed Patients. I would now like to introduce our presenter for today, Paul R. Hales. Paul R. Hales, JD, is widely recognized for his ability to explain HIPAA rules clearly in plain language. He is an attorney licensed to practice before the Supreme Court of the United States, a graduate of Columbia University Law School and senior counselor of the Missouri Bar with an international practice in HIPAA privacy and security. I would now like to hand over the floor to the speaker. Over to you, Paul.
Thank you, Ethan, and welcome to everyone. And thanks very much for spending your time with me today. I will try to use it wisely. We're going to talk about the fact that emails and text messages that contain protected health information and are sent by HIPAA-covered entities, healthcare providers, health plans, detail. Now, as Ethan said, I am a lawyer, and the first thing I want to promise you is that I'm not going to speak in legalese. One of the things that we do, and we try very hard to do, is to explain legal concepts in plain language. So let's take a look at what we're going to talk about today. What is our agenda? I'm going to start with an overview and some key takeaways. So, HIPAA privacy rule. There are 4 rules, and they are the enforcement rule, the breach notification rule, the security rule, and the privacy rule. And here's some information about that. That's a clickable link on your right. So, in looking at our overview, when must you encrypt emails and text messages that have PHI in them? So first, encrypt all emails and text messages containing protected health information. Why is this important? Why is it important to be very, very careful about emails and text messages that contain protected health information? Pandemic emergency, and in the course of that, there's been a massive growth in telehealth and telemedicine. And the fact is that medical identity theft, Inspector General at the Department of Health and Human Services, unencrypted emails and unencrypted text messages, and those are electronic transmissions, the gold standard, as this very brief video produced by the Inspector General of Health and Human Services, that these criminals attack people of all ages and all walks of life, and they use what is called social engineering technique. It was Henry Ford, major hospital healthcare system in the Detroit area. And in October of 2021, identifying phishing emails is be really wary whenever you see clickable links in the phishing email. And in this case, these criminals jump on whatever is current or of concern. Monkeypox. Resolve your issue with your tax ID number. Well, the internet is really a well of misinformation. And as you look at the internet, and some key HIPAA definitions, 3 terms that are really important. So encryption is one, electronic transmission. That's finally protected health information. Or first of all, what is encryption? Conversely, what is an unencrypted email or text message? What is an electronic transmission? Let's take a look at protected health information. I mentioned earlier it's misunderstood. So what is PHI? How to de-identify, define what protected health information really is. Email and text messages the internet to phone text messages started as an email. So here's the three-step safeguard for email and text messages. And they still prefer an unencrypted email, then covered entities aren't responsible. So the background on this duty to warn, 3 steps, duty to warn, let the patient decide, and document it in writing. Here's a way to do it, and this is in your email. If a patient says no, again, it's 3 steps. Don't send, obviously, and be very careful when you hear HIPAA compliant. Some misunderstand the TCPA. So this is a vendor of appointment text message, violates HIPAA. Some vendors misuse outdated OCR guidance. And there's a key special condition under the TCPA, an order that came out in 2015. The Supreme Court unanimously said no. Major national healthcare provider policy that you accept if you're regarding getting text messages, the 3-step safeguard for HIPAA when you must encrypt. Okay, this is key. The security rule has a required standard. That's email. For text messages, we go to CMS. Refused to allow secure texting of any patient information. When you're following that, you've got it documented, the 3-step safeguard for emails and text messages between providers and patients. Asks patients to authorize hackers and criminals. So it's about fundamentals, and really the steps are easy to follow step by step. When you follow the 3-step safeguard, and it's documented for patients, and then here's your form. So I thank everyone for your time. And again, I also want to wish you well in your HIPAA compliance. HIPAA is a process, and it's a process of steps. And don't get too worried about the regulations that are so darn hard to understand. When you break it down, the steps are easy to follow step by step. And the HIPAA steps are a blueprint for protecting your organization, whether you're a covered entity or business associate, as well as for protecting the patient. So I wish you well. Thank you for your time.
So thank you everyone for participating. You all may disconnect now. Thank you for your patience and the collaboration with us. And thank you everyone.